Good evening. Welcome to NTV People's Parliament. My name is Betty Mudondo, and I'm the Speaker of the People's Parliament here on NTV, and we're coming to you live from Mubende District. And we are discussing matters health and the state of health in Mubende and accessing healthcare services. Now, when we speak about healthcare, we are talking about organized provisions of medical services to maintain the health of the people, you and me. And we can't talk about health and we don't talk about preventive care, curative care, rehabilitation services, and palliative care. Now, this all entangles into the health sector, and we're here to understand in Mubende, all these different sectors, are they working? If they are not, what is the way forward? In this particular segment, we are going to look at the way forward. So, honorable members, welcome again to the August House. And I would like to thank everyone who is watching from home. We are still in Mubende and coming to you live, talking about matters health. I want the way forward. And before I take on to any other speaker, so much has been said about the education sector. And so much has been said about the health sector. And I want a representative from the DHO's office to first at least create a balance of what has been going on. It will be very unfair, and it will be a disservice and injustice not to hear from the district health officers themselves. And earlier, I asked you, Honorable Member, to please look out on the points that I noted. And some of these were talking about the specialized department, the state of health center 2s and 3s. We have had power supplies, mothers giving birth on a torch. We have had late referrals. And then how big is this generator? Because the fuel that was stated on that microphone, my oh my. So we are looking at that, and also the doctor-patient ratio. Please kindly clarify on the different voices.
I thank you for giving me this opportunity of being here on People's Parliament.
You're
Voice.
most welcome.
Members, good afternoon. I am Namsoke Mary, the acting DHO, Mubende District. I just want to give you the updates on Mubende District. As Mr. Speaker, allow me to say about Mubende health sector.
Can I go with Madam Speaker?
Sorry?
Madam Speaker.
The
voice is big, but I'm going to go with Madam Speaker.
Madam Speaker, allow me to say about Mubende. As the Mubende department, it consists of services which we conduct. We have delivery of promotive, preventive, curative, palliative, rehabilitative health service at all levels. It also consists of environmental health, mental and child health, health education, stores, data, subsector, respectively. Within the Mubende district, the district serves a population of 672,900. We have a total of 55 health facilities, Madam Speaker. Madam Speaker, we have the ownership of these facilities. The level, we have the regional referral, which is the government. We have only one. Then we have the general hospital. These are private for profit. They are in total of 2. Then the health center 4, per now we don't have the health center 4. The health center 4, which are supposed to have, that is Kasambia. It is in progress, it is upgraded, and some facilities are being constructed. Then we have health center 3s within Mubende. Government, we have 15 health center 3s. PNFP, we have 3, that is St. Joseph Madudu, Mulete, Subi. Those are the PNFP. Then private for profit, we have 3. A total of 21 health center 3s. Then health center 2s, we have 28. PNFP, we have 1. Private for profit, we have 2. A total of 33. All totaling 55 health facilities within Mubende district.
Let us first hear. I'm going to call on to you for order. Let us first submit.
The health subsector has been committed, Madam Speaker, to improving routine services delivery at various Health Center 2s and Health Center 3 existing in a district. And these are the performance indicators as they stand. Indicator number 1, we have the DPT, whereby this is annual average. We stand at 95.4% versus the national, which is 92.5%. Again, Madam Speaker, we have IPT3 coverage, whereby we stand at 43% versus the national, which is 47%. Okay. Then the institution deliveries, as of Mubende, we stand at 54.8% versus the national, which is at 65.7%. Then the under 5, who are receiving vitamin A second dose, we stand at 57.9 versus the national, which is at 47.3. Then pregnant mothers tested for HIV and enrolled on ART, we are standing at 74.4% versus the national, which is 79.5. We have 0.5 years who are dewormed. The last 6 months, we stand at 89.5% versus the national, which stands at 93%. Then the Latin coverage within Mubende, we stand at 80% versus the national, which is 79%. Then the sub-counties, which are having the health center 3, Madam Speaker. In Butologo, we have Butologo Health Center 3. Chiyuni, we have Chiyuni Health Center 3. Madudu, we have Madudu Health Center 3. Kalonga, we have Health Center 3. Chenda, we have Chitenga Health Center 3. Bageza, we have Gayaza Health Center 3. Mwaso, Madam Speaker. Nabingola Town Council, we have Nabingola Health Center 3. Kasambia, it is going to be upgraded to Health Center 4, which is in a process and under construction.
And as we construct, we're also looking at the facilities, we're also looking at the services being elevated, because we have a regional referral hospital and we are having honorable members saying there is no electricity.
Very soon. Then Chigando, Madam Speaker, is also, we have Butawata Health Center 3. Chibalinga, we have Chibalinga Health Center 3. West Division, this is within the municipality, there is a Remikomago Health Center 3. Then Lubimbidi, this is a newly upgraded health facility, which is commissioned, it is newly constructed, it is staffed, and it is equipped with the equipment. Also, we have commissioned another achievement. We have Nakawala, which is in Kasambia sub-county. It's newly constructed, Health Center 3. We posted their staffs, Madam Speaker, and also we have equipped with the equipment. Now it is function. Okay,
as we wind up, because we had a point over there, and there are some points I told you to note as as an administrator from the DHO's office. I want to know whether some of these concerns, because it's one thing to elevate them, the health centers, it's another thing to have them, and it's another thing to be functional. So I want to know whether some of these have been received in the DHO's office.
Yeah, Madam Speaker, all of them are functional.
And what is the way forward? Because this segment, we want to know what is the way forward. What is the way forward on the drug stockouts? Actually, there's a point that was raised by an honorable member about selling drugs outside of the hospitals, doctors owning personal clinics and selling drugs. So I want to understand what is the way forward, because if this is here, however good the infrastructure is, however good the buildings are, and people are not getting these services, we shall still come here to Mubende next year and we shall have the same discussion. Am I lying, honorable members? So please help us understand. Has this come to the DHO's office, and what is the way forward? One, on the blood, drug stockouts, a lack of enough blood at these health facilities, the ambulances as well, and the doctors having. Also, they talked about the specialized unit. They are saying sickness has no classes. So I want to understand what is the way forward.
Thank you so much, Madam Speaker.
You're going to help me and move closer.
Well, thank you so much, Madam Speaker. As for the regional referral, we have the administrator, but the data I know, within the hospital, the regional referral, they are just having a mini blood bank. We don't have the big one which serves the region. Okay. More would be added on by the hospital administrator.
Okay.
Then secondly, on the issue of the facilities, theft of drugs, it used to be there, but those culprits were taken to police. The police is responsible for all that.
So there are some cases already going on when it comes to people
Investigations are being going on with the police.
Okay.
They are being handled by the police.
Okay.
Yeah.
Okay, thank you so much, Honorable Member. I want to take this opportunity to give you a chance to wind up in just a few seconds, because I want to pick onto the floor. I want to hear what the people have to say. And then Mr. Onesmus will come through, because I need, when we speak about health, we are going to speak it from a point of more informed view, because it's a matter of life and death. So I'll have the members also tell you what they think should be the way forward, because it's very important. They know what they want. They are the people that we serve. So please wind up, and then we can have other members from the floor.
Madam Speaker.
Yes, please.
Madam Speaker, they talked about the stock out of drugs within our health facilities, but we already received four cycles within the district, and we are yet to receive the fourth cycle. Whenever some facilities have a stock out, we do the redistribution. We always seek out from facilities which are stocked, then we restock other facilities. It is being done by our IMO within the district, that is SOAS manager. He does that.
Is there any objection or addition? Yes, please, from where you're standing, from where you are. Let me first hear from a honorable member who hasn't said.
Madam Speaker, I want to paint some information to the current speaker.
Is that microphone on?
About the issue of the drug
Stock out?
Yes. We are speaking about a referral hospital whereby they do bring drugs into the hospital, which we as patients do not want. You reach to an extent.
Honorable member, is it about the drug that you want, or the drug you're supposed to receive for a particular prescription?
Madam Speaker, let me try to bring it up in this aspect. That you reach an extent, for example, in the municipality, we are experiencing an escalating number of dogs. And then we do experience also an escalating number of dog bites. And you move to the referral hospital, you want treatment, but there is no stock. You are only given Panadol. So that is an issue that as the current speaker tries to air it out, can you try to improve on that state? Can we have the drugs that really benefit we as dwellers of Mubende municipality and district at large?
Now that point makes sense, but at first when you said it, I said Omrada Ganye Dagala. So I was looking at you like Omrada Ganye Dagala. Thank you so much. I thought Omrade, the patient has refused the medication. So they are saying that yes, the drugs are there, but then there are some specialties where they are seeking specific medicine for specific illnesses or emergencies, and it's not available. Please address that immediately, because you're speaking about drugs.
Thank you so much, Madam Speaker.
How do you handle rabies in the first place? Any like dog bites? Because he talked about dogs, right? You talked about stray dogs, right? Yes. Hey, so
that is being handled within the regional referral. Since we have the hospital administrator, may I handle the health facilities?
Okay, let me write here for Mr. Onesmus. Mr. Onesmus, today we are stuck with me and I am stuck with you. Yes, so let me write it here for you. Yes, please, Madam.
Madam Speaker, the current speaker talked about referrals being late, like in Chiluma. Chiluma sub-county is a sub-county with one health facility at the level of health center too. And if you can see the topography of Chiluma, the tail lines and the hills, since it make these people to reach the facility very late. But what we have, the government has given us some money. We are going to construct more structures so that that facility is being elevated to Health Center 3. We thank the government of Uganda.
I'm going to thank you, Honorable Member, but like I told the Honorable Member who left earlier, that if we are talking about 5-year plan, let it be a 5-year plan. We are going. I think the people here are expressing their views on we are going. But thank you so much for representing the DHO's office. Let's give him a round of applause. She gave us numbers and figures you don't know about. The hospital is doing well. Where there is a good thing, there's always a bad thing. But the only challenge is sometimes the bad things are so brightly seen than the good things. So she gave us at least a figure of what the hospital is doing. And we are doing well. We are getting the services. But still, we shall address the challenge. Thank you so much for making NTV your #1 station. And remember, your voice matters, your ideas count, and they shape this nation. For now, NTV People's Parliament takes a very short break. When we return, we shall be having other members of parliament to give their lived experience in Mubende district as far as accessing health services is concerned. Stay tuned. Welcome back from that break. You're still watching NTV People's Parliament, and we are coming to you live from Mubende District here at Mubende Municipal Council Hall, and we are discussing matters health and the state of health in Mubende and accessing healthcare services. Please come and give us, what do you think should be the way forward? Because we are here to understand as the community and generally the state of health, but what is the way forward? What do you think? What if you had a talk with the Ministry of Education, Ministry of Health, sorry, if you had a clear conversation with the Health Ministry and members, what do you think you can tell them as the way forward, Honorable Member?
My name is Baleke Kaira Peter from Wekura constituency. I'm happy to have the DHO here. I think we have heard about health, but the situation is not all that good. And I think it is going to even worsen or deteriorate. Why? If you go to our health facilities, you'll find most of the equipment and drugs have been donated by USAID, WHO, and Baylor, those ones. Now, currently, USAID is pulling out. How are we going to bridge that gap if the situation is not going to deteriorate? WHO has also had a problem because the biggest funder of WHO is the US, and the US has pulled out of WHO. Now, and it has been our main funders in the health sector. How are we going to bridge the gap so that the situation does not deteriorate? So I think we need to think twice. We need the government to sit down and find a replacement of this funding that is now we are losing on.
Do we really
Thank you very much.
You're welcome, Honorable Member, but we shall also have to understand from the administration, do we really need a replacement? What can we do? What can we do as a nation? For how long are we going to have replacements? As we wind up this particular segment, I would like to pick on Honorable Member. You've been in that pillar for long. Please come and take to the floor of the August House and give us your submission on what is the way forward. It's very important because we need to know how do we move away from this. You're going to help me move closer to the microphone? Yes.
Thank you, Honorable Speaker, and the House at large. I'm Mubende Cornelius from Kiuni South County, representing Wekura South County. The problem I have is, since I started observing when I'm still in primary, to the time I joined the St. Peter's Technical Institute, there was welfare department taking care of patients, medical personnel, and attendants. But now they are starving All those parties are starving.
Okay.
Think of a medical personnel treating a patient when you have starved that medical personnel. And feeding a patient is part of treatment. The one treating a patient is starving, a patient is starving, and the attendant is starving. What problem is that in our treating facilities?
So before you die of the sickness, the hunger comes for you first. You're looking at each other like two hungry people. Okay. It quickens the journey. The honorable member is here saying that hunger quickens the journey. Okay. Mr. Nesmas, please help me note the welfare bit. It's very, very important. Help me note welfare. I know. At this point, I would like to have a honorable member from the back there. Please come and take the floor of the August House. No, right behind you. Please help me, producer. Help me push them forward. It's not ready. We can continue. You have your way forward. I'm going to come back to you. You already gave a way for. You already gave a point. You ha. Let me look on this side again one more last time. I had a gentleman. Let me have a lady from the back. Please remember, come to the floor of the August House. I'm going to try and balance this boat. We are going to have a man, a woman, and then it's a way forward, right, honorable member? Yes. And later, as I wind up, I'll have Mr. Onesmus take on the floor, and finally, I'll have the speaker who will wind up this conversation. Information on for me. Please go ahead.
Promises a date, Madam Speaker.
I promise. On the way forward. Let me prepare this thing. Don't worry. I have you. I still have you on my speaker. Let him talk to you nicely. You might give him with your 3 minutes. You might give him 1 minute, and you used to it. Talk to the speaker nicely. Please, honorable member.
Thank you, Madam Speaker.
You're welcome.
I'm by names of Nantubiro Grace. Councillor representing Busare Ward in Mubende Municipal Council, and I'm aspiring for South Division Mayor. Madam Speaker, concerning this issue, some people will lack patriotism. So, when we look at the health facilities, they lack patriotism. How? You go to the health center, you find someone is on WhatsApping. The patient is in bad conditions. For them, they are WhatsApping. So I'm requesting the DHO, let us use WhatsApp in its own time. 2,
but honorable members, you're the people giving service delivery. This is personal discipline, honestly speaking. This is personal discipline. If you're a health worker and you're here, you need to understand this is personal. It has nothing to do with the DHO or the health ministry. This is personal discipline.
Madam Speaker, my second issue is we are lacking people who are supposed to work in our individual areas. This goes to the Ministry of the Public Service. Our people within the district, when they request to work within the area, they are not given. So they bring people within our areas who have not even sympathy to our people. That's why Mubende Regional Hospital.
I beg to understand this.
Yes.
For example, we have village health teams.
Yes.
They are strictly in their villages working and supporting the health system.
Yes.
We have the choose also as well.
Yes.
So what you're telling, kindly elaborate on that point. I need to pick it well, and the members need to pick it well.
Madam Speaker, concerning this issue, Madam Speaker, let me say that I'm a DHO.
Yes.
I have the assistant.
Yes.
We have the midwives.
Yes.
We have all nurses and other sectors. When you reach at Mubende Regional Referral Hospital, there is no any person within the district. You find that person is on his saying, si wafe. Thank you, Madam Speaker.
Before you go, I need evidence. You first stand there. You see, I need to see clarity. Honorable members, do you agree? Who has evidence, at least to support people saying siwafe? Because it's very important to know. Because if we are seeking answers, we need to understand that you're serving. We are serving as a nation. You have to be patriotic. We must see one way, then that means we have to look for the way forward.
Madam Speaker, when you go to the public service,
Yes.
and you request for that list, do we have those sectors within the Mubende people working in Mubende Regional Hospital?
Mr. Onesmus, you'll be back here with me. Okay, thank you so much, Honorable Member. There's some information, but at this point I would like to first call Mr. Kasumba Hakim to come and take on to the floor before I take on to any other notification. Please come and take to the floor. Give us that burning issue, and I'll take some other points.
Good afternoon, everyone.
Good afternoon, sir.
I'm glad to be part of the People's Parliament today. I'm Kasumba Hakim, the District Surveillance Focal Person, Mubende. As far as my department is concerned,
Yes.
Currently, we have two conditions or epidemic conditions that we are handling. The first one is the measles outbreak, where we had an outbreak in Chiruma sub-county. We took off samples, they tested positive, and we are managing. Okay, because this April we have an integrated child health day, as long as a mini campaign to handle cases of measles we have. So we are handling measles. Affected sub-counties are Chiruma. We also got some alerts or cases in Butawata, that is Chigando, and Nabingola. So we are handling that.
Okay.
There is no big threat concerning that because we are handling. The other one is Mpox. We've had an Mpox outbreak. We've had a total of 45 cases, which have all been managed well at the Regional Referral Hospital. Currently, we have 3 admissions. Others were treated. We have no death. So we are doing that well in that regard.
Okay.
So in case anyone needs any more information concerning that, I think they are welcome. For more of the measles cases, whoever gets one will line list as we respond.
Okay, so honorable members, like we said earlier, we are here to see what is working, what is not working, and what is the way forward. And the honorable member is clearly educating that there is a measles outbreak. For the mothers here, the fathers, please be very vigilant. It's on, and in case of any other services. But they were asking questions earlier about payment. Are these services free of charge? Because we need to know before they come to the hospital.
Thank you very much.
That's one. Also, they talked about Mpox. Let us all abide by the standard operating procedures, but still, how are these cases handled? Are these services still free of charge? Because people need to know before they come to seek the medical services. Clarify on that, and we shall be winding up this segment.
Thank you very much. All these services are free, and they can bear witness. When they make alerts, I'm grateful to WHO. They've always provided fuel, and we've always gone, for those who have raised alerts, that they have cases, we've always gone, reached out to their homes, do in-field investigations, and we've transported those or referred those for free we're giving them ambulances to the regional referral, and they've been getting treatment at regional referral hospital, which is our isolation center, for free.
Okay. Thank you so much, Honorable Member. You're confirming? Please bring a mic here. Something good is happening here. A Honorable Member wants to confirm. Just give her the microphone. We need, she's doing a confirmation. We are speaking from facts.
Madam Speaker, what she is saying, it's true.
That?
We get services for free.
Which services exactly? Because you say, you're the one who said earlier.
The malaria, Mpox, those outbreaks.
Okay.
They are for free.
So the outbreaks are well handled at the emergency operating center,
yes.
and we are good. Let us
Yes.
give a round of applause to the regional referral hospital. We shall give credit where it is due, and we shall hold leaders accountable where we are supposed to not so. Murade said they give us tablets we don't want. Thank you so much for making NTV your #1 station. And remember, your voice matters, your ideas count, and they shape this nation. For now, NTV People's Parliament takes a very short break. When we return, we shall be having other members of parliament to give their lived experience in Mubende district as far as accessing health services is concerned. Stay tuned. Welcome back from that break. You're still watching NTV People's Parliament, and we are coming to you live from Mubende District here at Mubende Municipal Council Hall, and we are discussing matters health and the state of health in Mubende and accessing healthcare services. Now, when we speak about healthcare, we are talking about organized provisions of medical services to maintain the health of the people. You and me. And we can't talk about health and we don't talk about preventive care, curative care, rehabilitation services, and palliative care. Now, this all entangles into the health sector, and we're here to understand in Mubende, all these different sectors, are they working? If they are not, what is the way forward? In this particular segment, we are going to look at the way forward. So, honorable members, welcome again to the August House. And I would like to thank everyone who is watching from home. We are still in Mubende and coming to you live. Let me please have the senior administrator. We have had so many bullets coming for Mr. Onesmus, and here he is. Mr. Onesmus, you're winding up. We have Way of the Cross, we have another segment, and we have a refreshment later. You see, we have a view kunywa, that brought us for a whole crate of water. So please wind up on this. What is the way forward? Okay. Drug stockouts, shortages, doctor patient. Please just wind up. Just give us what is the hospital administration looking at as a way forward. I saw a CT scan. There were so many reactions on it that time when it broke down. I've seen the ambulance in the garage. We fix cars all the time. What is not happening? You see, please give us a way forward. Then I'll have the speaker to close up. We go.
Okay. Thank you very much, Honorable Speaker.
Hygiene, that is standard procedure.
What, hiding?
Are we planning? Were we planning for the next financial year? What are we doing in this financial year before we plan for the 5 years?
Okay.
Okay. Point of order. Now I'm going to call you to order. Honorable members, point of order.
Okay, thank you very much, Honorable Speaker. Allow me hint on most of the key issues which requires answers from the hospital management. One of them was bed capacity, that there are many floor cases and the government needs to give us more beds. Honorable Speaker, the truth is the hospital is 240 bed capacity, but the new block complex, it is 250 bed capacity. And the government has given us all those beds. They are there. Therefore, once we commission, meaning that we are going to have a regional referral with 500 bed capacity.
Oh, Bugalo. But
all those
you see, one thing I believe, if you pray and believe, things are going to come. But like we said, let a 5-year plan be a 5-year plan. Let the financial year plan be a financial year plan.
Honorable Speaker, we are doing it. And with the evidence...
You're on record, Honorable Member.
I'm on record, Honorable Speaker.
The one I will record back, eh?
Please, Honorable Speaker. Okay. And some of the district leaders, they have visited that new block. They have found all these things. They are there. I hope that one I can leave it at that, Honorable Speaker. Secondly, they are talking of blood bank, Honorable Speaker. Blood bank is on the 5-year strategic plan. Currently, we are at a blood collection center. We collect blood from Nakasero and we bring it to the referral hospital. In case the blood group is not there, we coordinate with Fort Potro, Hoima, and bring. At times when we call Nakasero, you find that that blood group is not there. Fort Potro is not there. And Hoima, it is not there. And the nearby health facilities, they don't have the blood group. We refer to the national referral, Honorable Speaker. And through lobbying, Honorable Speaker, management tried to lobby Club Rotary Metro, Mubende. They also lobbied their friends abroad. They promised to put for us a blood collection center.
Okay. And how soon do we...
Of recently, the governor came, they commissioned, we gave them even the land. It is in process, Honorable Speaker.
What is the land in process?
The land? The land is within the hospital.
Okay.
Even they even launched, they even put their post near the canteen area. Okay. I think the district health committee must witness this. The time they visited, yes, we reached there, Honorable Speaker.
Okay, thank you.
Secondly,
please, a round of applause. A round of applause. Honorable Member, we've been talking about blood shortages. They are giving us hope. We have people willing to come and support Beyond Board. And we have someone to clarify on that. Please, let me first take, because you're going to get credit where you, and we shall come back to you where it is.
Okay.
Please, Honorable Member, take to the floor. Let's have that confirmation they are coming through.
Thank you so much, Madam Speaker. Automatically, there are some loopholes.
Yes.
But where there is a credit, let someone do a big up to the government. Reason being that for us, we are health committee members. For us, we go and visit that referral hospital, even this health center 3 is. But on our visit, the director, rest assured us that they have already liaised with Mulago and where they can collect blood. But the only challenge is these ones with the racers, or plus or minus. Yes. Because those donors, they get problem when they are donating blood. So that is the only challenge about those ones with the A plus, O plus, but most especially those on the O plus. But there is a challenge which was addressed here, and I would like to also give the information. There's a client satisfaction survey.
You want to pass me by the eye like this?
No, I want to tell. No,
I am seeing you.
No, the fact is that
briefly, very briefly.
Oh, I have that one some information I want to give to the public of Mubende. Whenever they get money from you or charge money from you, or whenever there is something which is going wrong, there is a client satisfaction survey. There is that app, you go there to the health facility, you get it, then you also do that, say that you can report to that one who is collecting money from the people and any challenge. Thank you so much.
That is very good information. We have a client satisfaction survey report. When you get to the hospital, you can get it and fill in?
Yes.
Yes, so that next time we come here, at least, and then the DHO's office also said there are already cases being handled. So please, take part in the surveys. You see, sometimes we have these forms and you're not filling them in. Say Askari is asking for this and that. Let's put this on record, because it's very important to speak from record. Mr. Nesmas, please wind up.
Thank you, Honorable Speaker.
Yes.
Next was on feeding of patients.
Yes, and as well as the health workers.
As well
you said
as
a health,
yes, it's okay.
A hungry health worker and a hungry patient. Making it very what? He said making it very, making the process swift. Mr. Honorable.
Honorable Speaker, I thank this government because at least all health workers, we are paid lunch allowances, 330 per month. Therefore, on that money, we are supposed to feed ourselves, Honorable Speaker.
So we are saying, there are people who are enjauling themselves.
It is paid on your account personally.
That's what I'm saying. It is paid personally, but some people are going hungry because they have chosen to go hungry. Yes. So, honorable members, now you have the information. The people that you find hungry there are given 330,000 shillings to feed themselves. However, they decide to spend that money on a drink or what, it is up to them. That is clarified. Thank you so much, Mr. Nesmas. Let's continue. The healthy patient. That is patient loves herself. This patient wants to get something.
Then, Honorable Speaker, still we go further and provide food. We feed also the destitute. The patients who have no attendant, whose address are unclear. They are identified by medical social workers. Even at triaging at emergency, we see how is this patient brought, has no attendant, has no one. Therefore, that one is also fed.
Honorable member is saying that is correct. Thank you so much. A round of applause at least. Let's give credit where it is due. Honorable members behind there, you're cheating me. You're not responding. You're not giving me a round of applause. It's very important because initially, before you came in, Mr. Nesmas was on the spot to explain to us what is exactly happening, and he's here giving clarity. And I'm seeing no objections. People are confirming that what he's saying is true. So we are still winding up.
Still on the same person, Honorable Speaker, we also extend free CT scan service.
Yes.
We give a waiver to this person. That one we have been doing it, Honorable Speaker. In case it is required, we really give it, because he has no one to pay for him.
A waiver.
A waiver.
Okay.
Then, Honorable Speaker, on the issue of corruption. Corruption, I will not say it is not there, and I will not say that management is supporting it. Personality, we are like a home, we are like a family. But management has tried hard to make sure that we are emphasizing professional code of conduct and ethics. A person to serve you must be in uniform, well tagged, and we have even gone ahead to put our telephone numbers of the management, that in case of anything and you feel you are not served well, call these numbers. Honorable Speaker.
Hold that hand. Let me first have him clarify everything, then I'm going to pick on you.
Therefore, the few who call, we receive them, and we really help. Because even myself, I stay in the hospital, Honorable Speaker. Even the director stays in the hospital. Even the senior principal nursing officer stays in the hospital. Majority leaders in this region, they have found us, even past midnight, at whatever time we feel like, we have availed ourselves there.
But there's a point here, and I want to raise it here and then. My sergeant at arms is telling me that the two numbers were covered at the end, the emergency lines. Please clarify on that and get it cleared out of the way. People need to call, but the last two numbers were covered.
It's okay.
Is it true, honorable members, that the last two numbers? Now, why were the numbers covered? Is it an accident? Is it? Mr. Nesman. You're waiting.
Okay, Honorable Speaker, that one had not come to our notice.
Okay.
But now that I've got it, we are going to correct the anomaly,
Thank
Honorable
you so much,
Speaker.
Honorable. But you're winding up. You have less than how many? Is that what
Then for the case of
Finally.
congestion at emergency,
Yes.
that one is expected everywhere because it is a triaging area. For example, if maybe an accident, or a bus has got involved in an accident, we are supposed to bring all to emergency. Then it is a sorting area. This one should go to this department, this one should go to this department, this one should go to this department. Even those who are not supposed to be on duty, it is our role, us who stay in the hospital, to call them to come and give a hand to those who are on duty. And we have done this, Honorable Speaker.
Thank you, Miss. Thank you so much. I think we have it from Mr. Onesmus. Let's first let us, because initially we grilled Mr. Onesmus that we got him out of his chair to bring him at the front. At least let's give him credit where due. Let us give him a big round of applause for representing that hospital. You're coming. But also let me also make a point. Hygiene is also a personal discipline. I'm also let me say something. Honorable member, you're not in order.
I have it here. I will mention it here.
Yes, I want you to explain hygiene to him because I want him to be in order. What is hygiene? Please talk about hygiene and we wind up this. No, let us first finish with
okay. Honorable Speaker,
hygiene.
On the issue of hygiene, we had issues with the latrines.
Yes.
And we had to involve even the key stakeholders from LOCs, even health village team, then also district health committee, even district health committee, security team. We involved them in a way that our local people, majority, don't know how to use these latrines. Majority don't come with toilet paper, Honorable Speaker. And others use stones, others use bottles, others use gauze, and after use they drop it.
In the flashing, the toilets for flashing.
Yes. Therefore, you find that a latrine which would last for a full year, we empty twice or thrice in a what? In a year. Therefore, we had to call the key stakeholders such that we plan together. It has not only happened to Mubende here, it has happened in Soroti, in Lira, and we have all gone there to benchmark. They have even put a fee, but which majority leadership here have rejected. But elsewhere it is working. A fee for a toilet paper.
Okay.
It is not more than 200 shillings. it is only charged to a person who comes without a toilet paper. And a service provider sits there, then whoever comes who doesn't have a toilet tissue pays 100 shillings, they give him a tissue and uses. And the one who has come with it is not charged and cleans that one. And 3, after the person going there, then the person pours water and cleans.
Yes.
The district committee, health committee passed it, but it was rejected by the members of parliament, even the district security team. It has not worked only here in Mubende, but elsewhere
It is working.
It is working.
Honorable members, we have refused to buy toilet paper. Is that the sanitation you're talking about, or any other sanitation?
No, of course I was trying to tell them that whenever you go there, there are water shortages.
Hey.
And those who are, the pit labs, of course, it is not water. It's pit labs, but when someone comes out there, there's no water for washing.
Okay.
In the previous, maybe 2 minutes, 2 months.
Okay.
I presume maybe this week,
Hey.
what he's talking about is it is there.
Okay.
But generally speaking, the hygiene is not good there.
Mr. Onesmus, but now because we know what is bringing it, we are going to try and educate, I think. We educate the people as they get into, because this is a village setting. Everyone knows a hole, so we shall stick to the holes. Mr. Onesmus, thank you so much.
Okay, you're
I
welcome.
really, really appreciate you for giving us a clear insight. Let's give him a round of applause. I'm going to take on to this particular moment to call on to the speaker to wind up this conversation. I'm going to come back to him. We shall speak in English. Don't worry, honorable member. We shall speak English. You wanted to give him some of your minutes? You're a very generous man. You want to give him? Just a minute? Yes. On your time you have, he has 3. One is his. He's a very generous man. Please come and give him a handshake, because you will have to pay for that 1 minute. Don't think it is for free. You owe him 1. He has 3. He has 3. Original handshake. You see where we are going, honorable member. You're talking about corruption. You have only 1. He has 3. You have 1. He has 2. Please, my secretary, don't feel pity for him. You really don't. Okay.
Thank you, Madam Speaker.
Yes, please.
My speaker trusts that I will represent him well in future.
Please go ahead.
Where are we going? Way forward. We need to have good governance and effective representation. What I expected Mr. Onesmus to say is that I need money. So as part of governance, we need to increase the vote of the regional referral hospital beyond measure to fit the strategic plan for them to move. Number 2, we need to increase the votes for our health facilities. But as we increase, let us accredit them. Each division in the east, south, and west should have a health center 4. Let's have our health center 2s into 3s and 3s to 4. That way, we are decongesting the regional referral hospital. And supporting it to serve. I submit.
Thank you, thank you, thank you very much for being part of NTV People's Parliament. For those that are here in the August House physically, I really, really appreciate your time. It's a very, very hard time, the weekend, as we all know it. But I thank you so much for being here. Thank you for representing the people of Mubende. The hospital administration, I would like to thank you for representing the hospital, the DHO's office, members present, leaders, councillors, the mayor, and everyone who has been here today physically. Thank you so much for being part of this conversation as we seek to build the health sectors in the different sub-counties where we come from. Thank you so much for watching NTV People's Parliament. We are coming to the end of this episode today here in Mubende District, and we've been coming to you live from Mubende Municipal Council, where different members of Parliament have come out to air their views on the state of health in Mubende District. We have clarified on what's happening at the Regional Referral Hospital that is serving across 5 districts and also other districts coming through, including Mitiana, Chegegwa, Kasanda, people coming through from Gomba as far as Chiboga district. We've been in Mubende today, and we are here again next week. Be part of this conversation, and remember, we are coming to your region next. You who is seated at home, next time it could be your region. Be part of NTV People's Parliament. We are here to serve. Your voice matters, your ideas count, and you shape this nation. Thank you so much for being part of this conversation. Stay tuned. By the powers invested in me, I adjourn this house until next time.